Hello. 10 years back when I finished my fellowship, I was very well trained at Shankar Nitralaya, and a good mentor taught me about ROP. She told me whenever you are going, wherever you are going, you have to do ROP. So when I came to Chandigarh, when I consulted some of the very senior private practitioners, they taught me one thing. Doctor साहब आपा पंगे नहीं पैना, आप ROP नहीं करना इत्थे. But I went against them and I set up a ROP practice of my own. I would be covering under these few topics. So as I said, the first thing is good training. Good training before you do ROP, a good training is very important. And not only ROP, we should be knowing some aspects of neonatology as well when we are dealing with these babies, and hands-on for laser and intravital injections if it's possible for ROP cases. At least if we have interest to do ROP, we should do medical retina, which includes lasers and anti-VEGF. Attending regular ROP webinars, CMEs and conferences is important, and also we should be a member of ROP society. Next is proper equipment is required, though it's not a very costly equipment. Any retina person would be having these in his armamentarium. So an indirect would be required, 20 diopter or a 28 diopter lens, speculum, indenter, green laser. All retina, any person who's doing retina would be having this green laser. Only additional thing which would be required would be a LIO. So that won't cost much, and I have a dedicated staff who handles my laser whenever I am traveling for ROP lasers, and portable fundus camera, or even nowadays we can click pictures through our mobile devices. So this is what I carry in my ROP screening bag, which is already discussed. And this is, I have a dedicated person who's packing my ROP laser with all the thermocols so that it doesn't get into a jerk. It's properly packed. Sound nahi aa raha. Music. And this LIO is properly packed with all its curves, avoiding sharp bends, because this is the most delicate thing. Any sharp bend can break the LIO. And this is my indirect ophthalmoscope bag. And the same person attaches all my lasers and LIO and in the NICU setups, and we are able to do the lasers. Video of how I do intravitreal injections for these ROP babies. Initially I was doing these ROP injections in the OT setup, but nowadays I have started doing it in NICUs only in the warmer. So baby has to be nicely wrapped before the procedure, because sometimes OTs can be very cold. So proper wrapping of these babies. Using the IV betadine solutions, the things required for intravitreal injections. And adult size, because we don't have these small eye drapes, these adult eye drapes can be used, which can cover both the eyes simultaneously. It can be covered. A drop of paracrine on the betadine, cleaning with the betadine solution. It's 1 ml from the limbus and half the dose of adult dose. I prefer Avastin in these babies. The needle should be pointing towards the optic nerve. It's parallel to the nimbus and not perpendicular. And to avoid full penetration for these babies. change the gloves, keep the same trolley. The assistant also changes the gloves, and the injection is performed similarly to other eyes as well. We have to stabilize the eye with buds because the baby is moving, the eye is moving. Always examine the baby the next day whenever you have injected the babies. Whenever we are starting to do ROP, we should explore level 3 NICUs nearby our place, and we should have a good reputation and rapport with our neonatologist and pediatrician friends. Sometimes government hospitals also outsource ROP specialists because sometimes ROP specialists are not available in the government setup, and we can organize CMEs. Proper documentation is very important for ROP. Before doing ROP, we should have all the consent forms, bilingual, trilingual, for screening, lasers, anti-VEGF injections. These are available with the DOS and the AIOS consent forms. All these are the consent forms and the screening forms which should be available. Medical indemnity is very important. I think medical legal aspects will be covering later on during these presentations. And I personally have an indemnity of 1 crore because I am doing ROP. And in one of the conferences, it was told like if you are practicing ROP, the cost of 2 BHK apartment should be the cost of your indemnity. And whenever we are in doubt, don't hesitate to refer to your friend, higher center, take a second opinion. And counseling is very important for the parents before we are screening and treatment. It's very important. In their language they understand, and we have to be keep updated with the latest ROP literature, and if possible to take photos or draw diagrams. Thank you.
Thank you very much. Excellent.